Hello viewers, welcome to Island Health View, a program designed to bring you matters related to health in Dominica. I am your presenter, Rima Alfred. This program will be brought to you on SAT TV this and every Friday. In this segment, we will take a look at a recently conducted in-service training program on basic life support. During that program, a number of nurses from across the island were given hands-on training as well as theoretical information on the do's and don'ts in administering basic life support. We will have more on this when we return after this. Stay with us.
DigiCell, in collaboration with Special Olympics Dominica, invites groups to register to participate in a Special Olympics torch run carded for Sunday, September 21st, 2014. The torch run will take place from 6:30 to 9:30 a.m. from the Botanic Gardens through the streets of Roseau and back. This includes a 30-minute warm-up session sponsored by DigiCell. To participate, all you need to do is pay $10 and give yourself a chance to win lots of prizes, including top-up from our DigiCell promotion. Your contribution to this event will go towards facilitating the 10-member Special Olympic team from Dominica to participate in the Special Olympics World Games in California next year. Register now at DigiCell or the Office of the Dominica Olympic Committee. DigiCell, partnering to enhance inclusion of Special Olympic athletes in society.
Welcome back. Basic life support, or BLS, has been defined as the level of medical care which is issued for victims of life-threatening illnesses or injuries. This type of care is administered to those in need until they are able to obtain full medical care at a hospital. This treatment can be provided by trained medical personnel, including emergency medical technicians, paramedics, and by laypersons who have received BLS training. At that point, the person administering the care would need to have the ability to identify a need and act under pressure, while still maintaining composure to remember and apply the skills of basic life support.
Hey, are you okay? Activate the emergency response, grab the AED. One, 2, 3, 4, 5, 6, 7, 8, 9, 10, 11, 12, 13, 14, 15, 16, 17, 18, 19, 20, 21, 22, 23, 24, 25, 26, 27, 28, 29, 30.
Nurses at the Princess Margaret Hospital, the island's main health facility, were among the participants of a training exercise in basic life support. During the training, the nurses were introduced to a number of resuscitation techniques, how to administer CPR to a victim drowning, having a heart attack or a stroke. Also, any scenario where a heartbeat has been compromised. Facilitator of the training program, Dr. Agathine Scotland, a former nurse who once practiced in Dominica, was delighted to have been given the opportunity to work with nurses at the PMH.
Thank you for the privilege of working with nurses in Dominica for better patient care and for the safety of patients. Many islands in the Caribbean, including Dominica, do not have an established continuing education program for nurses. Continuing education is necessary for any profession, especially nursing, whose pledge commits its members to lifelong learning.
This BLS certification is a vital qualification for the medical or non-medical personnel receiving this training. According to the American Heart Association, a victim's chance of survival is substantially higher when a bystander has basic life support skills and can render aid immediately. Basic life support does not include giving drugs or performing invasive procedures, as outlined in the American Heart Association Advanced Life Support Guidelines. Dr. Scotland is of the view that this training ties in with the need for increased training for the nurses and other healthcare professionals in Dominica and the Caribbean region by extension. During the 4-day training program at the Princess Margaret Hospital, the nurses gained knowledge on administering CPR on adults, children, and infants individually and with a team. They were also taught how to use an AED device, which is used to shock the heart back to life.
At the end of this program, you should be able to promptly recognize cardiac arrest within 10 seconds of its occurrence, that you should be able to perform prompt, high-quality CPR with CAB sequence for the adult, the child, and the infant. You should be able to demonstrate hand positioning and other CPR techniques. You should be able to demonstrate individual management of CPR, team management of CPR, indication for the AED, and to demonstrate how you can set up the AED to shock the heart into a rhythm.
Skills needed for BLS include safety to the provider as well as to the victim. Therefore, using a barrier device when giving mouth-to-mouth resuscitation is necessary when administering aid. Just as important is protection against bodily fluids such as blood when helping an accident victim. An inexperienced rescuer should always remember to exercise caution when approaching and rendering assistance in an unfamiliar surrounding. Main facilitator of the training exercise, Dane Lawrence, along with Dr. Agathene Scotland and Nurse Deborah Roach Phillip, taught the nurses the necessary steps in the resuscitation of a victim.
In the soft part of the throat, because you may cut the air supply off. Okay? You put 3 fingers in. Once you put 3 fingers right here, you could use 2 or 3. Some people's fingers are shorter than some. They may need 3 fingers to hold the mask on properly. So you're going to use 2 fingers. Next thing you want to do is tilt the head. Don't forget, tilt the head.
The bone. All right, not
on the jawbone.
Yes, on the jawbone.
And then you tilt the head. 1, 2, 3, 4, 5, 6, 7, 8.
The training was not only beneficial to the nurses. I too got my hands into the training as well with the help of the facilitators.
You know the little bone that we have sticking out there? You want to look for it, put your 2 fingers here and put your heel right here. The heel of the here.
That's one way of finding it. The other way is just use
11, 12, 13, 14,
count out. I want to hear you counting also. 25, 26, 27, 28, 29, 30. 2 breaths. 1 second each.
Island Healthview is encouraging parents, especially single parents, as well as daycare personnel, grandparents, aunts, and other relatives of infants, children, and adults to use any opportunity to gain this knowledge and practical skill as a security measure. And that's all, folks, for this edition of Island Healthview. Be sure to join us next Friday for another edition. Until then, I am your presenter, Rima Alfred. Thanks for watching.